So this morning, I'm Elizabeth Stewart. I'm the Corporate Director of HIM Services for HRS, and we're going to talk very briefly about budgeting for ICD-10. So there's a connection when you're setting up, everybody's worried about timelines for ICD-10 right now, but in order to set up a budget to go along with your timeline, or vice versa, you need to connect them together. You have to know where you're going and when you need to get there in order to decide how to get there, kind of like when you're travel planning. If you know you want to get to a certain destination before you can plan it and know if you can afford it, you have to actually know where you're going, and then you work backwards through the process. You have to look at your budget in terms of the big picture. Short and long-term budget planning that you tie to timelines with actual outcomes are going to be easier to justify. If you need to ask for money, you need to be able to talk about how you're spending it, when you're spending it, how much you need, and what's going to be the outcome at the end of the day. So ICD-10 budgeting, what we're finding is that a lot of people are talking about I-10 budgeting in relation to what's it going to cost me for training, or what's it going to cost me for a system update, but there are a lot of other things you need to think about in terms of your budgeting processes. You need to think about pre and post implementation activity. So when you're planning your budgets, really you should be looking at 2 to 5 years of budget plans. So for right now, I mean, clearly you would be doing 2, but you need to continue to think about I-10 budgeting beyond October 1st of 2014 or December 31st of 2014 or whatever your fiscal year is that ends, because you're still going to be continuing to work on activities associated with I-10 implementation. It's not like you flip the switch on October 1st and then everything's good and you move forward and you don't have to think anything about I-9. We'd like that to be the case, and if we can figure that out in an app format or something, we'll let you know. But otherwise, you do have to keep planning, because you're going to have cleanup processes. You're going to find out things as you go along after October 1st or even right before, that you may have additional expenses that will be ongoing associated. So you have your pre and your post I-10 transition expenses. So you're going to have training, you're going to have system changes, you may have staffing changes, you may have need for staffing augmentation where you're going to bring in contract coders to help you through the reduced productivity periods. You're going to have people who are continuing to do ICD-9 work, because unless you can get all of your billing done through September 30th by October 1st in the morning. And then don't forget about all the claims that you've submitted in the last 18 months that still could come back to you because perhaps someone took another look and they disagreed with you. RAC reviews, CMS can go back 7 years, so you're still going to have I-9 activities. That's also still associated with your I-10 budgeting. You're going to have staff who can still handle those activities as well as the operational things going forward. And then ongoing program maintenance for new initiatives that are permanent changes. So if you implement or augment a CDI program, you're going to have to still budget for those activities ongoing, and that's something that we may think about, oh, we added staff, so we just plan for, we have another 3 FTEs that are directed towards clinical documentation improvement. But if you plan for any of the ongoing, if you're using systems, continuing education, or any of the peripheral education that may come out of that, or activities that come out of it, like physician education. So you're going, you need to also think about, when you're thinking about I-10 training, you need to think about non-training expenses that are going to be associated with your operational support as well. So your actual education and training costs, internal versus external. The internal costs may be, if you're going to develop your own I-10 program, if you're going to do your own AHIMA certified I-10 trainers, and you're going to take on your own education that way, that's still an expense you have to account for. And while the budgeting piece is important, and why we want to talk about all those moving parts, is that there's so many questions about, and there's a lot of conjecture, how much is I-10 going to cost everyone? Well, I-10 is going to cost much more than the training piece. So if you really think about your budget globally, you're going to be able to talk about how much it costs your organization to implement I-10 over a number of years, and not just even that year prior to going live. And your external costs would be for training and education costs, anything that you purchase, either out of box or consulting, or some hybrid type of education that you may be offering for your staff. But then you also have to think about staffing coverage, because while you're doing training, while you're doing your biomedical science foundation education, so if people are going to be taking online courses, they need time to be able to do that. You also need to think about dual coding. If you're going to be doing dual coding, it's going to take longer. And even if you're only going to have your regular staff coding 4 charts a week, 2% of their normal work, whatever you decide to do, what's going to happen to those 2 charts, 4 charts, 10 charts a week that they coded in your normal revenue cycle? Who's going to do that? And how are you going to account for that time? How are you going to account for when you pull somebody out for training 1 day, 1 week, 2 days a month, 2 half days a month, ongoing? You're not going to get all your I-10 training done for your staff in 1 single day. Even if you do, you're going to have to compensate for that staffing as well. So there's staffing coverage, some people call it backfill coding, that you're going to have to think about as well. What you need to also think about is I-10 training when you're talking about expenses. If you are adding new software, if you are upgrading your software that you're using, there are training costs associated with that. Depending on how your organization wants to look at your I-10 expenses, you need to budget for that type of training as well. If you're implementing a CDI process or a CDI program, there's training associated with that. You need to, and if you're doing it in light of I-10, you need to think about that as part of your I-10 budget. It also may be easier to acquire the resources. If you're being allotted a little more freedom with your I-10 budget and a CDI program or some greater initiative has been approved, then you need to think about including those, including that training in those budgets. It also is associated with 10. Hard and soft copy resources that the coders are going to need to use for I-10. Well, I order my coders books every year. Why are you counting this in the training budget? Because you're going to start doing your I-10 training if you haven't already. You'll be starting by early next year. Everybody's still coding in 9. Those 9 books are your normal books that you're using on a daily basis. You're going to need to purchase ICD-10 resources for training your staff in ICD-10. So it really is an additional expense over and above. It's not an operational cost yet. When you think about redesigning any of your queries, clinical documentation forms, other processes in your departments that may be impacted by I-10, it's not the cost of the queries that we're necessarily changing the queries or changing the forms that we're talking about. It's the staff time that you need to allot for using those forms. So if you use a whole new set of queries, or you're going to be querying in an entirely different way, you're going to need to spend time training your staff to use them. So it's not just 5 minutes and here's a new form, go use it. If you have dramatic changes in your clinical forms, not related to queries, but in general, you're going to have to spend some orientation time with staff so that they know what they're looking at, particularly for coders who are going to be in those documents every day. So there's different ways that you can look at budgeting, and some people are very good with it, and other people say, I don't know where to start. I'm really not sure what you want me to look at. And different organizations want to look at different things. But one way you can look at what your expense is going to be is to look at how many hours you're going to be taking staff out of the office in terms of training, because you're going to have to compensate for those lost hours either in overtime or in agency staffing, contract staffing, augmented staffing, whatever you refer to them as. So one way you can do it, you can use a budget calculator, which you can create yourself. This was done in Excel, and you can look by department. So you have a set of departments and the number of staff in those different departments, and this refers to both little c and big C coders who may need training, and then to look at how much it costs for each person based on how many hours of training that they would need. And so if you're going to allocate those hours to a section in your budget for education time or for I-10, this allows you to understand what that cost of taking those people out of operations to train them would be. Separately, when you're looking at direct expense estimates, so you're trying to figure out what's it going to cost me to work on these different sections of I-10 preparation. So you may, in terms of training, you'll look at education and training, your biomedical science, just do the assessment. So how many FTEs do you have? What are the normal salary, wage, and benefit costs for those people as a group? If you have any capital costs associated with acquiring, if you're going to buy a system of some type, like a learning management system or something, or an operating cost that might be buying a lower-end software licenses. But you still have to think about it's people and places and things when you're budgeting. It's not just the cost of the software. When you also think about your actual biomedical science courses, say you have somebody who's got to take a 40-hour course. Well, how are you going to compensate for their time? What's it going to cost you to pull those people out of operations, and how many people are affected? And that gives you an idea of what the overarching cost might be. So those are the sorts of things that you look at. Your technical training, what's it cost to buy or build different types of software or systems. If you're going to do web-based or client-server or learning management system-based training, what's it cost for developing training on site? So you're going to include in those types of costs, it would be the cost for the trainer, but it would also be the cost for any resources that you might need.